Today we are talking about a condition that can cause a range of symptoms, often leading to misdiagnosis and prolonged suffering for those affected. Let's welcome Dr. J.P. Saleeby, Medical Director from Carolina Holistic Medicine, who is back to discuss Bartonella infections. Dr. Saleeby, great to have you back with us. What is Bartonella?
Well, many lay people may have heard of cat scratch disease or cat scratch fever. So you can contract this microorganism from a lick or a scratch from a kitty cat. But you can also acquire it as part of a series of co-infections when you get bit by a tick or a flea. They're called co-infections.
Okay, and now what are the common symptoms or signs of Bartonella?
So yeah, so it's a kind of an unusual disease. It's usually co-infecting with Babesia and Borrelia, which causes Lyme disease. But Bartonella has some things you don't even need a blood test for. Now there are blood tests, there's PCR and some other Western blot and fish tests to diagnose it, but you can make a diagnosis by just spending 30 minutes in the room with the patient, doing a good history and physical. If there's tick bites, if there are kitty cats in the picture, and there are these unusual things, usually on young men, teenagers, adolescents, of what they call stria. They look like stretch marks, but they're not stretch marks. They're in the wrong place. And the worse that Bartonella is, the more pronounced they are. Now with treatment, they fade away, but they look like stretch marks. A lot of times on the back.
Okay.
And that's one. And the other is extreme pain in the bottom of the feet. So it's migratory pain. There could be pain all over, but mostly if you say, hey, are your feet hurt? They're like, how did you know that? You know, that's a pathognomonic for it. And the other is mental health issues, rages. You have children, mostly adults, that will rage or go off the rails for no apparent reason. Usually lasts like 5 or 10 minutes and then they're back to normal. Sometimes seizures occur also.
And now you mentioned earlier that the young men are most likely to develop those kind of stretch mark looking rashes. Is it more common in young men?
I think so. In my clinical practice, I have more young adolescents between the ages of 8 and 19 or 20 that present with that. And usually they're brought in by their parents because of behavioral issues or a history of Lyme disease or excruciating pain, especially in the bottom of their feet.
And now what is your approach to treating this?
So there are a constellation of anti-parasitics and antibiotics that can be used in combination. I'd be getting in the weeds if I started talking about those, but some are called macrolides and some are some of the anti-parasitics like mebendazole, Mepron, things like that can be used in combination. And also herbals. There are some botanicals that we use to treat. One is called Hootenannia. And I like to use a mix of both. I like to start out with the botanicals because they're a little gentler on the system. And if we're not getting anywhere, then I bring in the antibiotics. Okay.
And now, before we go, I want to jump back just a second to when you were talking about the raging, right? And it's scary because I feel like you could assume that maybe someone is mentally ill or going through some other things. Have you experienced a patient that has came in with Bartonella that you were able to diagnose them with this, but maybe prior they weren't able to get a diagnosis from a doctor?
Certainly. So with Lyme as well as Bartonella, we see psychiatric illness manifest. So a lot of times I'm the 15th doctor that they've seen, and the last 3 have been psychiatrists. Some have been institutionalized with psychiatric disorders like schizophrenia or bipolar and been medicated with drugs that actually make their condition worse. So that's a clue. If you're giving someone Geodon for their psychosis and it makes it worse, well, you're not on the right, ballpark. So yes, I have seen folks that have come out of institutions and they're loaded up with psych meds. We take them off of all their psych meds. They do much better. With treatment, they improve.
Wonderful. Well, Dr. J.P. Saleeby, thank you so much for joining us today. And as always, CarolinaHolisticMedicine.com is where you can find more information and reach Dr. Saleeby. Thank you so much.
All right.
We're back after this.